people. Under the law, we're supposed to be giving cost-sharing assistance to the insurance companies that are on the exchanges in order to keep rates down and in order to provide greater affordability. We're supposed to be creating high-risk pools for those who have higher risks in terms of their health care to spread the cost. All of these things are not being done as the law requires because the President seeks to undermine the Affordable Care Act. And it's only going to get worse if the President takes us back to a day when insurance companies denied coverage for pre-existing conditions and women were denied the right to reproductive health care. Make no mistake, that's what's at stake in the Supreme Court battle that we are just about to start over Justice Kennedy's seat. Already, the Trump administration has put protections for pre-existing conditions, protections I fought so hard to include in the Affordable Care Act, and Congressman Norcross has defended in the House against Republican attempts to repeal it, on thin ice by refusing to defend the protections in a Texas court case that is working its way through the federal system and soon working its way to the Supreme Court. They're not only refusing to defend those protections, but they're actually arguing, this is the administration, they are actually arguing that they should be found unconstitutional. Instead of defending the law that Congress passed and signed by a previous president, normally the Justice Department, the Attorney General's people would be defending a law that Congress passed and has been signed by the president. They are actually working to undermine the law and suggest that the protections that we created under law so that you could not be discriminated because you had a pre-existing condition, a child born at birth with a genetic disease, a father who had a heart attack and then from then on had a pre-existing condition. The list is endless. With this latest flip-flop, the Trump administration has recklessly endangered 52 million Americans living with pre-existing conditions across this country, including nearly 3.8 million New Jerseyans who have a pre-existing condition. And I was pretty shocked at that number because we have a little over 9 million people in our state. 3.8 million have a pre-existing condition. They are cancer survivors, children born with genetic disorders, they are workers who struggle with diabetes and chronic pain, they are women who've dealt with complicated pregnancies. They are potentially every patient who walks through the doors at community health centers like CamCare. And remember, it is insurance companies that, prior to the law, decide what counts as a pre-existing condition. That means that any one of us is a denial away from huge medical bills. It's no exaggeration to say that protections for pre-existing conditions form the very heart of the Affordable Care Act. And it's now possible we'll have an extremist Supreme Court justice willing to drive a stake right through it. Senate Republicans already stole a Supreme Court seat by refusing to consider President Obama's nominee. And there's a real possibility, a very real possibility, that they're going to rubber stamp any right-wing judge put before them. We must be mindful that everyone on this president's short list came pre-approved by the Heritage Foundation and other right-wing groups whose views are far outside the mainstream of most Americans when it comes to reproductive rights in this country. And that's why we need to make it clear to our colleagues back in Washington and to the American people in the coming weeks, who hopefully will raise their voices about what this process should look like and who should be considered to the Supreme Court. A vote for President Trump's Supreme Court nominee is a vote to criminalize abortion and take us back to an era in which a woman was not able to make their own health care decisions in consultation with their family, her doctor, and her God. If my Republican colleagues were truly concerned about reducing abortion in this country, they would support access to affordable birth control. They would support comprehensive sex education in our schools that is proven to reduce unwanted pregnancy. They would join Congressman Norcross and I not just in defending Planned Parenthood, but expanding access to affordable primary care, particularly in minority and low-income communities that have been historically underserved. They would support policies that are truly pro-family, like paid maternity leave for every mother to recover from childbirth, bond with her newborn, and secure affordable child care in her community. But they don't support these policies because I believe they don't believe in preventing unwanted pregnancy or helping working families lift themselves out of poverty. Simply put, they're on a crusade to roll back the reproductive rights of women, no matter where the American people stand. So I believe this battle for women's rights and health care is a human right, and it isn't going to be one necessarily in the Congress. It's going to be one in our towns and in our cities. It's going to be one at the ballot box. It's going to be won by everyday citizens rising up and speaking up for their rights. The rights of women to decide when they become mothers. The rights of families to avoid sky-high emergency bills. The rights of children with pre-existing conditions born at birth to be covered, regardless what an insurance company says. The right of every American to get the care that they need. That's how we stopped the Republicans from repealing the Affordable Care Act and ending Medicaid as we know it. That's how we protected coverage for nearly 1 million New Jerseyans. That's how we protected community health centers in the budget. And that's how we're going to stop this administration from taking us back to a time and place that none of us want to go to. That's what's at stake in this fight. That's preserving this very institutions like CamCare is at stake in this fight. Because if insurance companies can then decide that unlike the law as it requires now to pay CamCare the equivalent of any other provider, to make sure that anyone who walks through the door gets service, to ultimately change the nature of what insurance is in our country, then we will have gone back to a time and place that none of us can afford.
Hello, I'm Jamie. I've been to CamCare for, regular checkups and OBGYN, dental. I actually got my teeth pulled. These are dentures. I actually got them finished in New York, but I started the process here. It's a great team. The doctors always made me feel like wanted, and they never judged me. I've been to 3 rehabs, and every time it was not what I needed, but thanks to CamCare, they stuck with me and pushed me to do what I had to do. It was difficult, but it was worth it in the end. Whitney has always stuck by my side, and, they're amazing here. Amazing. I want to say thank you, and I want to say thank you to you guys for having this place where, it's okay. It's okay to tell your story to people, and, I'm young, but, things happen, and I'm just proof that you can overcome things. Just thank you.
I want to thank you for giving me the opportunities to speak on behalf of CamCare and the services that they have provided for me. I thank God for CamCare because I'm a senior citizen, I'm retired, and I thought my days were over of seeing a physician because of the medical expenses. So when I found out about CamCare, someone introduced me, matter of fact, someone in my church introduced me to CamCare. And I couldn't believe that I could get the medical care that I've been getting since I've been coming. I said, oh, I thank God for that. But I thank God for the panel here. I love your speech. I really do. And I've had great care since I've been here. I've been to the dentist. I've had some extraction. And I've been to internal medicine. When I got sick, I didn't know how I was going to take care of the medical bills and all that. That's when my friend introduced me to CamCare. And when I came here, the staff was very great. They were very polite. And the doctors was great. And I love CamCare. And I can say today, great job. Great job.